welcome to the Mendel's Clinical Pharmacy virtual experience. I'm just going to read this disclaimer real fast. So the PharmAssist virtual learning experience brought to you by Mendel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse. It is not intended to replace the recommendation or request of your healthcare professionals. All medications will be dispensed by Mendel's Clinical Pharmacy according to the prescription as written by the provider. So first off, welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mendel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing live medication instructional program on 3 fertility products, being Gonoloft, Menipure, and the Snare Patch, including interactive Q&As throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. We are joined by various amazing healthcare professionals each week from across the nation to provide you with real-world experience, just as if you are sitting across the table from them in a clinic. Today, we are joined by Kaitlyn Endicott. Thank you again for your time and interest this evening, and now I want to turn it over to Kaitlyn.
Thanks, Morgan. Hi, everyone. Thank you for joining me tonight. Like Morgan said, my name is Kaitlyn. I'm an IVF nurse in the Northern Virginia area. I hope that tonight's videos help you to understand and gain confidence with the injection and administration required during fertility. Tonight, like Morgan mentioned, we'll be discussing 3 different products. So we'll start off with the Gonoloft pen, then in the middle, we'll cover the Menipure Vials, and then we will end the evening with the Centerra Patch. After each video, we will have time for kind of a Q&A session, so you can type in any questions that come to mind while we're watching the videos, and we can tackle them as we go. Please do keep in mind that I can answer any general questions about the products, but I'm unable to answer any specific questions to your case, such as why you're on a certain dose of any given medication. Those types of questions I will defer back to your provider, as they are best suited to answer those for you. So with no further ado, I think we are ready to get started with our first medication. So that's the Gonoloft Ready Jet Pen. We are ready whenever you are, Morgan. In order to inject the Gonoloft Ready Jet Pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonoloft pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So I always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, that's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen, so anywhere that you can pinch an inch of skin and the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15-30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here, and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. Yes. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you will actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your Gonoloft pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the Gonolf pen. This one I really like starting out the program with because not only is it kind of pre-filled, ready to go, but it also doesn't require mixing. So, you know, it's a good one to start out with. It is also a lot of times one of the first medications that you will start in an IVF cycle as well. So it kind of works out in that fashion. One thing in addition to what I mentioned in the video, when you're pushing the plunger down, and having that window facing up towards you to ensure it goes to 0. The reason being is that this gray part here actually has a little bit of a give. So I've had some patients that think they're giving themselves the dose. They push the gray part of it in, but the medication actually is not coming out at that point. It's this red part. So when it dials, that's what moves is the red. So you want to push until the red part is going in. Okay, so just another tip there. Make sure the red is completely flushed at the end of the dose. All right, we are ready for questions when you are.
Yeah, looks like we had some questions. The first question was, what is the best time to inject? And do you have to be consistent with your timing in injecting that medication?
Yes, very common question. So I would first and foremost clarify this with your clinic. They may have a certain time of day that they prefer that you take the Gonolf, and some may not. So regardless though, typically it's recommended to keep the doses consistent every day. So I usually say within an hour or two of the previous day's dose is a good goal. Kind of make it part of your daily habit. That'll keep you from forgetting the doses as well. Very good question.
Beautiful. And looks like another question is how to store the Gonol-F. Does it need to be kept cold before using and then after using?
Yes. So I do recommend keeping your pen stored in the refrigerator until you're ready to use it. So when you get your box in the mail, take it out, put it right in the refrigerator, and don't think twice about it until you're ready to use it. Be sure not to put it in the freezer. I've had some patients that have done that. You do not want to freeze your medication. You're going to have to end up getting all new. We don't want that to happen. So as long as you store the pen in the refrigerator, it's unopened, then your pen is good until the expiration date. If the pen is unopened, so you haven't used it yet, and it happens to reach room temperature, it's okay. It's not, ruined at that point. Just keep in mind that it's only good for 3 months from the point that it reached room temperature. So depending on how that times out with your expiration date, it's likely it'll shorten that up a little bit. So you'll want to note the date that it reaches room temperature if that occurs, so that you can count out 3 months from that point. And then once you have actually used the pen for the first time, you've done your first injection, you got it under your belt, it does not matter how you store it at that point. So you can either put it back in the refrigerator if it's just easier for you to remember that it's in there, that's fine, or you can leave it at room temperature. Either way, it is good for 28 days from that point or until the expiration date. So whichever one comes first will kind of be your your stopping point for that med if you're not done with your cycle prior to that. I usually recommend just leaving it out on the counter with your toothbrush or something like that, but ultimately keeping it somewhere that you will remember to do it is the key there. So very good question.
Awesome. It looks like my question is, what are common side effects from using Gonolf?
Yes. So I would say probably the most common that I see is fatigue and bloating throughout the cycle, especially in the second half of the cycle when you've been on the medications for a little bit longer and you're having more of a response to the meds, within your ovaries. So when you think about what this medication is actually doing, it's kind of pumping up the ovaries, right? It's encouraging the development of multiple follicles within the ovaries. Say that 10 times fast. So because of this, it can cause some bloating and kind of some discomfort, which is very common, but typically you're going to see this subside in the days following your egg retrieval. So that's not something that's going to stick around for a long time. It's just until the eggs are retrieved and your body starts to kind of come back down to its baseline in recovery. So very, very good question.
Okay, it looks like another question is asked, do you refill the pen for each injection?
So it will depend on the pens that your provider orders for you. So a few things with this, the Gonolf comes in a few different doses. So 300, 450 units and 900 units. So depending on your dose will depend on how many doses you get out of a given pen. So if you have 300 unit dose daily, let's say, and you're only ordered 300 unit pens, and you're going to get, roughly a single day's dose out of each pen. So in that case, your clinic would have sent for multiple pens. You're not going to put, medication back into that chamber. As soon as the pen is done, it's all done. So pay close attention to that. If you're getting multiple doses out of your pen, be sure not to throw it away or discard it. That's money that we don't want to throw out. So pay close attention there. And then when you get down to the end of the pen and you'll kind of see that there's some, say your dose is 300 units and you have a 900 unit pen, in theory, 3 days dose should mean that the pen's out of medication. However, there is some overfill in the pens. So there's a little bit more medication than just the 900 units. And you can actually get that out of the pen if you want to get the most bang for your buck. So you can dial up to your typical dose, up to 300 for the sake of the example. Give your dose. You'll watch that number in the window dial down, but it's not going to make it all the way to 0. But you will see that your plunger is completely flush and there's no liquid left. At that point, you've gotten all of your dose out of the pen, and you will open up a new pen for the remainder of the dose, and you will dial up whatever number was left in your empty pen. So it actually does the math for you. You don't need to put, liquid back into these chambers. As soon as it's gone completely, you just discard the pen device in your sharps container.
Okay, I think that is all the questions that I see. We can wait a little bit longer, but I don't have any other questions that are coming in.
Perfect. So the Gonoloft actually comes in 2 different kind of forms or modes, I guess you could say, of how they supply the medication. So we just reviewed the pen. It also comes in a vial form as well. So this may be something that, if you want to look into, you certainly can. It's the same medication. It's just kind of different ways of providing it. They're both subcutaneous injections. So you're pinching that into skin for both. We do have videos that go over the vial as well on the PharmAssist page. So if that is something that you're interested in viewing just for a different option, you can certainly do that. Some clinics have a strong preference one way or the other. Others will leave it up to their patients and what they want to do, or if one is more fiscally reasonable, then maybe that would be a good deciding factor as well. So with that, any last questions, Morgan? Are we ready to move on?
I think we're ready to move on.
Awesome. All right. Well, next up, I think we have Menipure. So we'll get that video going. Any questions you guys have, pop it on in. In this video, I'm going to go over how to do a Menipure injection. First and foremost, I always say to collect all of the supplies you're going to need. That way everything is laid out in front of you and it's ready to grab and go. So for a Menipure injection, depending on your dose, will depend on how many of the powder vials you're going to need. So when you get your Menipure in the box, you're going to have little vials that have powder in them. Each powder vial is 75 units of medication. So I have patients on as low as 75 or maybe half of that, all the way up to 300 units. So depending on what your dose is going to be how many vials you gather. So for today, I am going to do 2 powder vials. That way I can show you how to mix multiple vials. This would be the equivalent of 150 units. So I have 2 of those, and then 1 vial of saline. No matter how many vials of Menipure that you are prescribed on, you only ever need 1 vial of saline. You're never going to have multiple vials of saline. So most patients, if you're on more than 1 powder vial for your dose, you're actually going to have a bunch of saline left over. That's completely normal. Then you want to gather your 3 ml syringe, and this just comes out of the little container like this. You also want to grab an alcohol pad to cleanse the skin. You will also need a Q cap. It looks like this. It'll come in a box with, I think, 5 or 6 of them, so you'll need one of these. And then finally, you'll need a needle for injection. Here I have a 27 gauge 1/2 inch needle, but you can also do like a 1/2 inch 30 gauge, that's fine too. So after that, I usually line up all my vials and take all the caps off. So these just come off like that. So take all the caps off of the powder and your saline. Then you want to peel back on your Q cap. There's a paper here. This peels back and comes off completely. Now your Q cap is actually in the plastic, and you want to leave it in there. This part is sharp, so you don't want to prick your finger on there. Then you're going to grab your saline vial, and this will actually press into the rubber of the stopper into your saline. Then you can take off the plastic piece, and that's just trash, and now your Q cap is on to your saline vial. Then you want to take your 3 ml syringe. I usually recommend pulling back the amount of air that you actually want to end up pulling water out of the vial. So for Menipure, you only really ever need 1 ml of the saline to mix your vials. So pull back until you can see there my stoppers at the 1. Then you're going to take your saline with your Q cap, and this syringe is just going to twist on, so it'll be attached. Then you're going to flip it over, push your plunger up so that the air goes into the vial. Then when you let go, it's going to kind of naturally pull water back. When that happens, sometimes you can get a little bit of air in the top, and I'm not sure if you can see it there. If that happens, just push everything back up and then restart and pull back until your plunger is at the 1 and you have 1 ml of saline in your syringe. At this point, we want to get this water into our powder vials. So we need to take our Q cap with us. What I mean by that is you're going to take one hand on your saline vial, the other on the Q cap, and it actually just snaps like this so that your Q cap is still attached to your syringe. Then you are going to place it onto one of your powder vials. It goes through the rubber stopper again. push the saline in. When you push the saline in, you'll actually see the powder dissolve almost instantly. Some patients like to kind of give it a little bit of a swirl around for good measure. Totally fine. Once you have pushed that saline in, then you're going to want to flip over again and pull back everything out of that vial. Now it's going to be roughly 1 ml because that's what we put in. Sometimes some of the water kind of dissipates when it mixes with the powder, so it might be a little bit less than 1 ml. That's totally fine. Once you pull back all of your saline or your mixed medication out of the vial, this is 75 units. 1 powder vial, 75 units in the syringe. If your dose is 75 units, you're done at this point. You don't need to mix any more, and you'll be ready to put your needle on, so stay tuned for that. But I am going to show how to mix additional Menipure vials just in case your dose is more than 75. So like I said earlier, for this video, I'm going to pretend that my dose is 150 units. So I am going to do the same thing I did before. We need to take our Q cap with us. So take off the empty powder vial, keep your Q cap onto the syringe. You're going to grab your next powder vial that you haven't mixed yet. Same thing. Push your cap on, push your saline in. That powder is going to dissolve. Then you're going to flip over, pull everything back. It's okay if you have some air in it at this point because we're going to prime our needle anyway, so we'll get all of that out of there. Once you have mixed this vial, we do not need our Q cap anymore. We have our dose. Our dose is 150. That's 2 powder vials. We are ready to put our needle on. Now, if your dose is higher than 150, then you're going to want to, at this time, move on to your next powder vial and keep mixing with this same 1 ml of saline. But for this video, we're going to go ahead and get ready to inject. So we do not need our Q cap anymore. Up to this point, we have held here and snapped off here. Now we don't need our Q cap. So we're actually going to twist this off, leaving our syringe by itself. Now, if you accidentally, just from habit moving along, and you take off your Q cap and it's still on your syringe, you can just twist it off and your syringe will be by itself. So now we have our full dose in here. We're ready to inject. So you're going to grab your 1/2 inch needle. This is going to peel like a banana peel. And here is your needle. And this just twists on to your syringe. At this point, I usually recommend priming the needle, which means kind of pushing up on that plunger until all of the air is out, until you see a couple bubbles come out of the top of the needle. Now, in this video, it might be hard to see through the lid that is on the needle, so I'm actually going to take it off to prime it just to show you. But when you're doing it yourself, you can actually see the needle through there. But you are going to push up until you see a few bubbles come out of the top there. Once you see a couple of the droplets come out, you know that you're primed and ready to go. So you can set that aside. Now you want to prep your site for injection. So this is where you're going to take your alcohol pad, pinch an inch of skin in the belly or in the thigh. This is a subcutaneous injection, so anywhere you can pinch an inch of fatty tissue, fair game. I usually recommend doing the belly for these. So you'll take your alcohol pad. This is going to be my skin for today. You'll open it, wipe off the skin, let it dry completely. That'll take away any stinging from the alcohol going in to the skin with the needle. Once it's dry, you can take off your cap, pinch your inch of skin, and you're going to go in fast at 90 degrees like a dart. So 1, 2, 3, and in. Once it's in the skin, you're going to press your plunger until it's completely in. Once it's in, you can take your needle out, get rid of this in your red sharps container, and at that point, you are finished with your injection. Now, depending on how many vials of Menipure you're ordered on, you might find as you're doing it after a couple days and you're mixing the saline that you're getting much less than one ml. A lot of my patients that are on 3 of the powder vials notice that they're all the way down to like 0.6 or 0.7 mLs. If that's the case, then you can actually pull back just a little bit more than 1 ml to mix, like a 1.1 or 1.2. That can help keep the medication diluted throughout the water and less stinging with injection. Key here is to remember, you do not need to do multiple injections for multiple vials of powder, right? We kept mixing that same one over and over. It's like concentrating lemonade in a pitcher. You're not adding more water if you're concentrating it, you're adding more powder. So same amount of water, just more powder vials. I think that's all my tips and tricks for this one. I hope this is helpful, and that's how you will do your Menipure injection.
Okay, so it looks like a question. How does Menipure work?
Yes, so Menipure helps to encourage the growth of follicles. So it's made up of FSH, which is follicle stimulating hormone, and it has LH in it as well, luteinizing hormone. So within the ovaries are follicles, within the follicles are ovaries, ovaries, eggs. Ovaries, within ovaries are follicles, within follicles are eggs, guys. So in a typical menstrual cycle, every month, our brain chooses one follicle, one egg to become mature and dominant, which at that point it either ovulates and ends in pregnancy or ends in a menstrual cycle. Now, what we are doing with these medications is we're actually kind of overriding our natural cycles, and we are giving more of those hormones that cause the follicles and eggs to grow in a typical cycle. So we're giving a higher dose of those hormones to encourage the development of multiple follicles. So as follicles are developing within the ovaries, there's eggs inside of them. They kind of hang on to the wall. If this is your follicle, the egg kind of hangs in there. And that's what we're measuring throughout an IVF cycle, is the sizes of those follicles that in combination with your hormone levels gives us an indication of when they are mature and ready for retrieval. So this Menipure is actually overriding what our brain would typically do in a natural cycle of sending out those signals for those hormones, and we're actually giving them to the body in a higher dose in hopes that we get multiple follicles and multiple eggs at the end of the cycle. Very good question.
Perfect. It looks like someone else asked, does the needle head go all the way into the skin?
Yes, good question. So I do recommend putting the needle all the way in for this one. When you're pinching that inch of skin, that gives a lot of tissue for that needle to go into. Usually just all the way to the hub. Don't think about it. Fast and quick is the way to go. You'll feel it less and it'll be over quicker. But yes, it does need to go all the way to the hub.
Perfect. And does icing the skin or applying ice or heat prior to injections actually help with the injection, the pain of the injection?
Yes, so I would recommend doing ice as opposed to heat. Heat is going to cause more blood flow to the area, so it might be a little more tender, have some residual, not a lot of bleeding after, but a little bit more than maybe is typical. But icing the skin can certainly help. And then, like I said, going fast and 90 degrees like a dart, the faster you go, the less you'll feel it. And the more that you do the injections, the faster you'll get with it as well. But yeah, you can certainly ice the area for these ones.
Perfect. And then Tim kind of questioned with the Gonolef, but how do you store Menipure?
Yes. So Menipure is typically stored at room temperature. I would recommend avoiding like direct sunlight, so a lot of heat to it. That way it kind of keeps the integrity of the medication. But when you receive your shipment of medications in the mail, you're going to see that some of the meds are in cool packs, some of them are not. That's a good indicator right there of what you need to do with them. So if they're in cool packs, then key is to keep them cool. Put them right in the refrigerator, not the freezer. And then any that are not in cool packs, you can just leave somewhere, whether it's on your counter, somewhere shaded, that's not going to get direct heat exposure for an extended amount of time.
Okay, perfect. I think it's all the questions we have right now, but we can wait a little bit longer and see if anyone else pops in.
Perfect. Sounds good. So let me think. Another common question that I get just about IVF injection medications and so forth is the timing and fear of missing a dose. So that's always, an added stressor. Not only how do I do the medications, but what happens if I forget one? So like I said earlier, taking the injections on a consistent basis is key, not just to have that consistent exposure to the meds throughout the cycle, but also it becomes part of your daily routine. So it's part of your habit. You're less likely to forget it. Also using things like your little reminders on your phone, your calendar. Some patients keep Post-its on their mirror in their bathroom and take them down as they go. Or just utilizing our little home gadgets that we have around, the Google devices and the Amazon devices. I won't say the name because mine will go off in the background, but it's just one less thing that you have to worry about during the cycle, if we utilize those resources to help keep us on track. Inevitably, things happen, right? We're humans. So because of that, I would reach out to your clinic prior to starting and just seeing what they recommend. If you were to miss an injection or be delayed in one, how they would want you to handle that situation. That way, if it does pop up, you are well equipped to handle it, whether it's contacting them for further guidance or if they have a general kind of rule of thumb for certain amounts of times, if you're off in your daily injection. So any other questions, Morgan?
Yeah, actually, I have one more. Someone asked, do the injections hurt or burn when you're giving? Which I know you kind of touched base, but maybe kind of go into more detail about that.
Yeah, absolutely. So the Menipure can burn if you're on a higher dose, so if you're on multiple powder vials. Now, one way that you can help to combat that, like I said, right, it's like concentrating lemonade when we're mixing. So we were adding more powder and not adding more than 1 ml of the saline. But what we can do is if you are on a higher dose and you're finding that those doses are coming out to like 0.6, 0.7 when everything's mixed together, because it kind of takes up some of that water, you can add a little bit more water to help combat that and make it less potent, and that can help with any kind of burning or stinging with the injection. Now, we don't really want more than I would say, what do you think, Morgan, like 1.3 to 1.5 mLs for a subcutaneous injection. It'll cause irritation. So it's a fine balancing act. Do you agree?
Yeah, I say nothing 1.5 because then you're putting in more liquid, which then is going to cause more skin irritation. So it's like you're kind of battling two different things. So we typically say no more than 1.5, but I think 1 is like the golden number that we recommend.
Yes. So whatever you can do to try to match that exact one, playing around with your daily doses and how much is really taken up by that powder. But like Morgan said, not more than 1.5 to help dilute that down. Too much water under the skin can cause irritation. So that's one way that you can help combat that. Very good question.
Okay, I think that's all the questions we have so far. We can get rolling for the next one.
Perfect. Sounds good. Next up, we have Centerra. So we are all set if you are, Morgan. Now we will review how to use a Centerra patch. The patches will likely come in packages such as this. So I recommend just gathering your supply there and deciding what site you want to use. Now, the patch does need to be applied directly to the site that you plan on doing an injection, and it does need to be applied about 20 to 30 minutes prior to your planned injection. So you'll take your patch out of the packaging. This is the top of the patch, so when it's on, this will face outside, and then the sticky part is here, and there is a plastic film over it that you'll need to peel off. So it comes apart like this. And this does need to be applied to skin that is unopened and clean. So if you have residual tenderness or scabs, I wouldn't recommend putting this over that skin. I would find a fresh new site. And then after that, you just apply the patch to the skin. Make sure it's flush against the skin. You do want to make sure to not cover up this outside part where it has these little vented holes. That's how the patch begins to do its magic. So when it's on, it'll actually feel kind of warm, and that means it's just increasing that blood flow in order to kind of absorb the medication even quicker. Once you have it on for 20 to 30 minutes, you can peel the patch off. And then prep the site for your injection. And that's how you use the Centerra Patch.
Okay, awesome. Okay, looks like the first question we have, does a Snare patch need to heat up? Or if it does, why does it need to heat up?
Yes, so the ingredients cause kind of that heating mechanism to occur. That's how, number one, you know it's working, and two, it also kind of helps blood flow to the area. So it helps to increase the effects of that medication as well. So as long as you feel that patch heating up on the skin, you know it's working, it's doing its job, so don't be alarmed there. Also, you want to make sure that you are leaving the patch open to air. So there's actually, I have one here. I don't know if you'll be able to see on the video, but there's little holes on the outside there. That's how it intakes the air. So when you have the patch on, you want to make sure it's not up against any like tight clothing or anything that would cause, you know, a covering over that would keep air from coming in. Otherwise, it won't be able to heat appropriately and kind of activate, if you will. Very good question.
And do you know about how long that the area will stay numb for after applying the patch?
I'm not 100% sure on this one. I want to say maybe an hour. Morgan, do you have any insight on this one?
Yeah, I think they say about it has effectiveness for about 30 minutes, but you
Okay.
shouldn't feel after like an hour. But I've had patients say only 10 minutes, and then some tell me like 2 hours.
Gotcha.
But no, nothing really longer than typically 30 minutes from what my patients tell me.
Perfect. Yeah. I mean, I know that, you know, it's kind of a one patch per injection deal. So if you do it for a morning injection, you have an evening injection, you're not going to be numb for that. So, you know, it's one patch per injection. Get rid of your patch. You need a fresh one every time.
That's
So
huge.
thanks.
Patients I've asked if they can reuse them, and I'm like, nope, you're not going to have the same effect with them.
No, you won't be as happy.
Agreed. And then what if, Snare, if it's like in your car, if it gets exposed to like heat, do you think that they'll still work as effective, or they should throw away and get a new one?
You can certainly try it. I don't think it's going to hurt to try, but it may not work as well. So if you find that, you know, it may have already kind of activated those ingredients in there. So you can certainly try it. But if you find that it didn't work as well, or if your skin isn't as numb, just, you know, kind of touching it with your fingernail, you could always put another one on, a fresh one that wasn't affected.
Perfect. And then with the Centerra patch, can you use it for sub-Q and intermuscular injections?
Yeah, absolutely. I have patients that use it for both. I have some that just kind of opt to do it for intramuscular injections, and that over time they've become a little more comfortable with the subcutaneous. But yes, you can definitely use it for both types of injections. Just make sure eventually in your cycle, when you're doing your trigger injections, that you're timing that out very specifically. You have to make sure you're giving yourself that 20 to 30 minutes with the patch beforehand. So your trigger shots are the ones that are super time sensitive. So you really want to be on top of those ones. But yes, to answer the question, you can use it for both routes.
Perfect. And it looks like we got a question. Is the purpose to just make the injection site more comfortable when administering the injections?
Yeah, that's exactly right. So the goal is that you won't feel it as much, if at all. I also would say that some of my patients tell me that with their progesterone and oil injections that they use in a transfer cycle, that the heating mechanism kind of helps to disperse the oil a little bit. So there might be some added benefit there as well.
Perfect. And I think that is all that I see questions coming in with the Centerra patch. I can say my patients love these patches, especially with the intramuscular injections like the PIO injections, progesterone oil injections, or their triggers. I think those injections can be a little scarier to use. So patients definitely are more hesitant, and with them, you really don't feel a thing. I actually tried it out one time.
Oh,
Um, I think they're awesome. They really do numb the site really well.
yeah, I 100% agree. Although they're technically optional, it certainly does not hurt to give it a try. So definitely something I would ask your providers about and see their take on it. But I can say that I don't think I've ever had a patient that says they wish they didn't try it. So
Yeah, no, agree. Okay, I don't. I'll see if there's any other questions, but I don't see anything else coming in as of right now. So, yeah, I think that that's it. Um, so let me pull up this.
all right. Well, thank you all so much for joining this evening. I hope that these kind of tips and videos and our dialogue has helped make you feel more at ease with injections throughout, any given treatment cycle. Another reminder: all these videos from tonight are provided to you afterwards. We post them on our PharmAssist page. They're on our YouTube page. They're on Facebook. So if you need to go back and review anything, didn't quite get certain details written down, it will all be there for you to go back at your leisure. I think that is it for me. I will throw it back to you, Morgan, to close us out.
Good. Okay, well, thank you again, Kaitlyn. You're awesome as always for all your expertise in those videos. And want to thank everyone tonight as well who joined us via Zoom and Facebook for sharing your questions. We hope that we may be able to make something a little more clear and learning how to do those injections. Don't forget all these virtual learning experiences videos as well as individual products and videos are available on demand at the YouTube page, just like Kaitlyn was saying, on the Facebook page, or at www.mymendelsPharmacy.com/PharmAssist. We look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard Time for another great program. Please share the PharmAssist program with anyone you feel might benefit from it. And thank you again. I hope everyone has a great night.